Today we'll talk of something which is notorious, which is one of the most troubled areas to lose fat from. That is your belly fat. Hello everybody, my name is Dr. Zubin Dev Sharma and I am a senior consultant in gastroenterology. Today we'll talk of something which is notorious, which is one of the most troubled areas to lose fat from. That is your belly fat. Now, belly fat is something which causes a lot of trouble when you are trying to lose it. And we tend to do n number of exercises, all those crunches, but we are still not able to lose. This is the most area which is the most troublesome. So, what are the small tips that we can do to try to lose belly fat? And maybe, if you follow these tips, it may be useful for you. The first and the foremost, most important thing for any fat loss program is diet. I think we need to understand the diet in bit more detail whenever we are trying to lose fat at any part of the body. So, if you talk of Indian diet, if you talk of Southeast Asia or world over for that matter, if you are consuming a high carbohydrate diet, that is the most troublesome for you. That usually gives you a lot of unnecessary carbs, and these carbs are usually transmitted or changed to a fat by various hormones which are activated in the small intestine, and ultimately they give rise to increased amount of fat in your belly. And if you also suffer from diabetes, then this gives rise to insulin resistance, and insulin resistance leads to production of more of a visceral fat. When I say visceral fat, I mean the fat around your belly, and you have to manage these symptoms well. So your diet should be very, very careful. You have to cut down on your carbohydrates, and you have to simultaneously increase your proteins. If possible, if you consume, then animal proteins are better than plant proteins, and a moderate amount of fat. So it's not only the fat which causes you trouble, it's actually the carbohydrate which is causing you more trouble. So the most important question is that how do we reduce carbohydrates in our diet? Since I have already told you that we have to reduce carbs, but how do we do it? So the way I tell my patients is that you can include a lot of different kinds of seeds. You can add quinoa, you can have other kinds of carbs. Try to mix and match and bring down your total carb load. Second thing is the consumption. For example, if you are consuming 4 or 5 breads in a day, various kinds of breads in a day, that can be brought down to around 2 or 3, and you simultaneously increase the amount of protein that you are taking. You should also try to cut down on the amount of sugar, refined sugars in your diet. That means that if you're consuming juices, which are pre-mixed or pre-bottled, they usually have added sugar to its contents, and this adds to unnecessary carbs in your diet. The same holds true for stuff like sauces, stuff like various premixes which are available. They usually have a lot of added sugar, which is certainly a no-no when you're trying to cut down on carbs. Now, you also have to understand that there are a lot of products where cornstarch is actually used for production and for balancing out things. So if you're using a commercial product, if you're using anything which is pre-prepared and has cornstarch, that is also adding to the carb load to your food. So try to read the labels that for various products that you are using and bring down the amount of carb as well as the refined sugars if it is feasible. Now, what are the other things that you can actually do? You can increase the amount of animal proteins that gives you a sense of fullness in the belly. This fullness tends to last longer, and hence automatically will cut down on the total amount of calorie that you take, and this will actually help you to cut down on your carbs. Same holds for fat. Now, completely checking out fat from the diet is not actually wise or doable. You need to have at least a moderate amount of fat in your diet to maintain your health, and this actually is not going to cause you too much of harm. Apart from the diet, I think the most important thing comes is an exercise. Now, there are various kinds of exercises which are available, which can be done to lose fat overall, and particularly your belly fat. So everybody used to recommend the crunches and the grinding and all that. But you have to understand that there's a lot of data now coming in, scientific data, which tells you that the high intensity, small interval exercises are actually equally good and sometimes, in fact, more useful to help you lose the belly fat. Even if you are not able to do those things, but if you still do the routine exercises like, excessive cycling and swimming and jogging and running, they also actually work equally well. What doesn't really work is when we talk of the exercises like yoga or stretching or Pilates, or they are usually to maintain the flexibility and the muscle of a joint. They will not really work on try when you are trying to lose belly fat. I think the most important thing would be a good intensive exercise regime which you can consistently follow over a period of time, and that will work wonders if you want to lose belly fat. Now, apart from the diet and the exercise, there are a lot of medications which has now actually come up in last few years, and they are creating a lot of noise around the world regarding their weight loss. And these are, some of them are injections and some of them are orally available drugs. First, you need to have a doctor with you, an endocrinologist with you, if you're even thinking of using those drugs. Number two, these drugs will not work if you are not combining it with a good diet regime and a good exercise regime. Hence, the first and second points are something which are still the most important points if you ever want to go on a belly fat losing program. Now, understand that these drugs will work only till you are consuming them. The moment you stop, your metabolism goes back to what it was, and you will again start regaining weight. And sometimes you will end up gaining more than what you were if you are not strict about the first two things, that is, the diet and the exercise. Now, you have to understand that in some patients, these things may not consistently work, but even if they do not work, they have better effects. Like diet and exercise has some more effects than just weight losing. They help you with an overall survival, they help you for a better cardiometabolic health. So exercise and diet should be a part of your daily regime. And finally, there are some surgical options also available, which I think require a different video to discuss than just this video. So these were the tips if you want to lose your belly fat. And I think managing your diet is the most important thing. Calorie in, calorie out is a basic concept that you need to understand. High intensity exercise is something which works better than normal exercises. But if you're not able to do them, any exercise will still work equally good. So I hope this helps you to get a better, healthier lifestyle. We'll hope to see you in the next video. Thank you so much for it. How to connect to us? I think it's not very difficult. The number is given. On this number, you can message us, WhatsApp us. A message will come back to you on how to take appointments. Appointments can be a physical appointment or an online appointment. A physical appointment is available at Fortis Memorial Hospital in Gurgaon in Haryana. And for online, there is an app which will be given in the message itself. You can also try to connect to this number. You can call this number. The caller will pick it up and guide you if you have any problems in trying to take appointments. So please feel free to message us. And the appointment is not difficult. As soon as you WhatsApp us, you will get a message for it. It may be some delay because there will be a lot of work going on, but you will definitely get a message. So thank you so much.